Lonnie Mullet here with helpforcounselors.com, where we help clients while making a living. I want to talk to you today a little bit about electronic health records. Boy, that sounds like a fun topic, doesn't it? For many of you out there, you've been resistant to going electronic, and I understand why, because I resisted too. But there's so much advantage to using electronic health records. The very first thing that I want to tell you that you might not have thought about is it does really provide a service to clients, because with my electronic health record system, I can bill any insurance company, even if they're out of network, which is a lot more welcoming to clients than handing them a super bill and then asking them to go bill insurance, which most of them know nothing about. And so that's a service that really doesn't cost me anything except for a couple minutes of inputting that data. And also too, it serves clients in that it really does a better job of protecting their electronic data, so that data is protected in an encrypted system online, and that you select a company that's strong enough to protect that data, and that it's duplicated. So they have two systems. If in case that fails, you'll have records. And then, even if your permanent records are destroyed in your office, a fire or some other kind of hazard, that you still have data that's protected and secure. The other thing that the electronic health records does is it really does save you time. Now initially, I'm not going to lie, the first time that you use it and for the first several weeks until you get all that client data loaded is very onerous, and it's very time consuming. But once you do that, I will assure you, if you get a good system, you will never go back. Because right now, I spend maybe an hour a week billing. That's it. I don't send long faxes. I don't have to look anything up. The data, once it's loaded, I just click that I saw the client, I enter my note, and it's gone. It's protected. And it's just so much easier. And then if you get a good system, it'll bill the insurance. And my system will even tell me when the payment comes that session was paid for that client. So I don't even need to reconcile it. I just kind of look at it and say, I got my money, that client's paid, the insurance is paid, no problem. No going back and redoing the accounting each month, which right there for me, that probably saves me 4 or 5 hours a month. And if I can get some time back from my life, it is well worth the few bucks that I spend on the electronic health record system, which for most systems are really less than $100 a month. And most of us are paying medical billers much more than that anyway, and then we have to do the work of putting it all down on paper and then faxing it to them. For what? The other thing that electronic health record system can do is some of them are inclusive in that they will provide you with an encrypted email that you can send clients. And even though you may not want to put protected data on there, we know that we've at least protected the information and we've abided by HIPAA laws. And it's just a safe way to protect client data. The other big advantage, which I didn't think a lot about in using electronic health records, to be honest with you, until I started using it, was when I go on vacation, I don't really worry about it. Because if I'm away on vacation and I get a call from a client who's desperate, I can go online on my iPad and I can look up their whole case file, send them to another clinician, and read right off the case file. So I know exactly where they're located, I know their home phone number. If they're suicidal and I get that call, I can tell the police right where they work, it really does serve clients. And it's really easy once you get past those first couple of days, months, weeks, not usually months, I'm just kidding. A few days and a couple weeks of loading all that data, which you can have someone help you with, like a medical biller or somebody to help you with that. But once that happens, you get all that advantage of the electronic health records. And you can look at that more in the future. You're going to see upcoming videos, or you can talk to me about what it would take to get an electronic health records, or to get even trained in-person live training to use an electronic health records here at helpforcounselors.com. Thank you for watching our video.